Hello again, and welcome to another one of our quick chats. We've been talking about various issues in the NHS, but also health and social care in the round. So not always as a result of the pandemic, but also about the future. But this one is a bit more focused on what's been going on with the pandemic and some specifics. And with us today is Keith Howkins, who's going to tell us a little bit about his work actually with the COVID Data Hub. But before we do that, Keith, would you like to tell us a little bit about what you do in the round?
Yeah, no problem. Thanks for having me, Adam. So I work for the NHS Wales Informatics Service. I started in 2004, known as Health Solutions Wales then. I started as an information analyst. So we collect data from various different data sets in Wales, so hospital admissions data, emergency department data. And my role there was to create reports, normally in Excel. I'd extract the data from our databases, create reports in Excel. To send on, typically for the Welsh government. So from there, I got a job, my current role as a publishing specialist, which is working with the same data, but creating dashboards and sort of online reports. So that was what I've been working on prior to COVID. And then sort of when COVID hit, we all had to sort of down tools a bit on our current jobs and focus on that. So I've been working from there on the COVID Data Hub.
So what sort of data do you pull together for that hub? Is it clinical excellence, or what are the sort of things? What's the information you're providing?
Okay, so so one of the things we sort of found with the data hub is, I guess, when it was clear what an impact COVID would have on the health service around sort of mid-March, I guess, and we were tasked by a director to create a dashboard to sort of aid the service with COVID. One of the things sort of found, and was a surprise to me really, is the number of new data sources that suddenly became available to us. So I think previously we've been guilty maybe a bit of working with silos and stuff, and people are a bit protective of their data. So in addition to sort of the data that I mentioned, we already have, like the admitted patient care data, emergency data. We started getting data in on lab tests, so COVID tests, bed capacity and occupancy, which was typically used by Welsh Government for planning purposes, mortality data. So we got data coming in from ONS, primary care data, modelling data as well. We've done quite a bit of work on modelling, so there are various different models of the pandemic out there. So that was quite an interesting one to look at. So I guess the Data Hub was a way it sort of evolved really from just being a single dashboard. In effect, it evolved to being a hub, a single repository for all of these different data sources. So people from the Welsh Government or health boards in Wales could go to the Data Hub and see what they wanted and get the data from there.
And what's the more typical uses? I know I think you were sort of briefing the minister as well and standing up and talking about what the rate was, how things were progressing, and there was other stuff as well, wasn't there? Yeah,
there's quite a bit of stuff in there, and I guess it depends on the end user really who's using it. So Welsh Government have used quite a bit of the stuff that we're collecting on bed capacity and occupancy. Yeah. Health boards tend to sort of look at the testing data, see the extent of the positive tests in their area, maybe compared to other areas. And as I alluded to earlier, the modelling section has been used quite a lot as well. So there are various different models of the pandemic and of deaths per day, of oxygen caseload. But because areas in Wales have got different demographics, for instance, then possibly a different model is applicable to a different area in Wales. So we've got a tool in the Data Hub which sort of assigns the best model for each area in Wales. So that's gone down really well. That's been sort of really useful for the modelers and Public Health Wales. The mortality data as well has been something that's quite heavily used.
What about patients? Do patients have access? Do patients use this? No, but what about the experience that they have within hospitals? I understand you're looking at that too.
Yeah, so I guess so that's something I was going to allude to as well. I did sort of mention that we have all these new data sources coming in. But obviously there are kind of risks with that as well. The data sources are new to myself really, and it's only kind of been the sort of pressure of time that we got stuff out there very quickly. And a lot of the systems that we're using, so the testing data systems that weren't initially built for reporting purposes, to be honest. So the data's come in. So we decided to only make it available to Welsh Government and NHS Wales, because people in the public could see some of the figures, maybe see some of the modelling figures, for instance. And they're only sort of predicted modelling if people aren't following compliance, but they could take the wrong message from that. So in that case, no, it's not a patient-facing tool, but I think prior to my work on the Data Hub, we were sort of looking at. I was working on an area called value-based healthcare, which was looking at incorporations on more patient-reported outcomes in dashboards to sort of enable patients to see, if I have this procedure, what are the effects on me? So I think that's kind of the area that healthcare needs to move into. Really, we spend a lot of money. And it never seems to be enough. So we need to really sort of evolve, I think, into using more sort of patient reported outcome measures. So that's something we started to look into, and COVID's kind of put a little bit of a stop on that. But hopefully it'll be something we can get back into. And I guess the one, it's not right to say a good thing, but I think it's kind of legitimized COVID and it's legitimized the use of data. So hopefully it will, there's people in the service and in the public who maybe are a bit skeptical about the use of data and about, say, patient reported outcome measures, I'm saying. But I guess this has kind of legitimized it as a bit. You turn on the news and there's data and stuff now, so they know how important it is, and so how it really underpins NHS.
Great. So you've seen a change in attitude, do you think, to people wanting and willing to allow you to work with more inputs?
Yeah, I think so. Not just as a result of COVID, to be honest, but over time, over the last few years, I think it's become more clear what a huge impact data have. I mean, I remember years and years ago telling someone in a pub what I did, and they called me an NHS pen pusher. And I think there is that sort of there was that sort of image of data. It's taking away money from hospitals and stuff, and people didn't realise that it really underpins what we do. But I think over the years that sort of it's become more and more clear that that's how important it is, and I think COVID kind of has hammered that home. So because without the data there, we'd be in a lot of trouble, really. Yeah,
and so you don't see the lessons that you've learned, the advancement that you've made with sharing data. You don't see it going back. You see this is here to stay now. People's understanding of data.
Yes, I think so. I mean, prior to COVID, I think we were already sort of getting things in place to go along those lines. So I mentioned about the silos of data we had, and that held us back a lot. But there was also already something we were aware of. So over the last year or so, our company and NHS Wales as a whole have been working on a national data resource. So it's looking to have one. It's more than this, I guess, but it's looking to have one big repository for all the data, breaking down these silos, making the data more available, bringing proper sort of data quality as well. So that's, if data is in silos and not necessarily built for reporting, that's obviously an issue as well. And then that will, I guess you've got to get that sort of technical architecture in place, and that underpins what I was saying about value-based healthcare and about using the data to improve sort of patient experience. You need the architecture there.
And what's your hope? I mean, we're not out of the woods just yet, are we? I'm sure you're modelling all sorts of things come the winter. What's your ambition, if you like, for the use of data and where you see this going next? How is this going to evolve?
Oh, right. Okay. Well, I suppose just to sort of reiterate what was said before is just to hopefully sort of legitimise the use of data. I think we need to sort of move, I guess, from the evidence-based system we've been using in Wales to a more value-based system, a more patient-based system. So incorporating more patient-reported outcome measures. So that's, as I mentioned, that's something we've been working on. But it's about getting the standardized tools there. It's no good, one health board using a certain set of patient-reported outcome measures and another set using another set reported outcome measures, because that's useless really for building dashboards on. So I guess my hope is that it continues to sort of legitimise the use of data. One area, I guess, not for all clinicians at all, but for certain clinicians, there is some reticence as well. It's not just the public, there's reticence about using data, I think. Clinicians may be resistant to change, which is fair enough. and I think we have a responsibility in that as well, to sort of go out there and as information people go out there and show them, we're not here to take your jobs or to narrow down what you're doing. We're here to help you, and this is what we've done to help in COVID. This is what we can do to help you in your jobs, and try to get them to buy in through that. So I guess so the ambition is to just plow on with increasing the role of data and getting it sort of more accepted within the clinical community and within the public as a whole. And it's only then, I guess, that we can really drive to make change, and with the technical architecture in place, really drive to make change to the service, positive change.
Perfect. Keith, thank you very much for talking to us. It's quite a complicated issue, but one that's very much in the public domain now, of course, with COVID and the pandemic and various things that have happened. It means that some of these things that used to be specific to IT and information people and architects, but actually it's sort of front page news. It's the figures that people are looking for and expecting every day. So we've certainly seen that shift, and I'm sure that I'm afraid that you're going to be really quite busy for the.
I think so.
Yeah. All right, Keith.
I think so. Keeps me busy.
Thank you very much for your time.
No worries. Thank you for having me. Thank you.